Welcome to the LA Area Business Showcase. This is our February shows are from the Central Maine Heart and Vascular Institute. I started working on this program before it was a reality in 1999, when the whole Lewis and Auburn community came together and was petitioning the state to approve a standalone heart program for Lewis and Auburn at Central Maine Medical Center. It was approved, and then in 2003, the Central Maine Heart and Vascular Institute opened, providing comprehensive heart care for citizens of our community and the surrounding communities. And they provide the full range of care for people with heart disease. This is the place to come when you want heart treatment, the Central Maine Heart and Vascular Institute. Welcome to LA Area Business Showcase. This week we're featuring the Central Maine Heart and Vascular Institute, and I am joined this morning by Dr. Carmine Frumiento, who's a cardiothoracic surgeon. Welcome, Doctor.
Thank you. It's nice to be here with you.
Your specialty is cardiothoracic surgery. It's hard for me to even say that. Could you tell me what the chest surgery program is?
Well, the CMHVI, or Central Maine Heart and Vascular Institute, opened about 7 years ago now, and it encompasses all aspects of cardiac care, including the medical care as well as the surgical care. So we do all aspects of cardiac surgery, whether it's bypass surgery, valve replacements, aneurysm repair, and whatnot. You mentioned the term cardiothoracic surgery. The thoracic part is chest surgery other than cardiac, and of course that involves the lung, the esophagus, any masses in the chest.
You talked about surgery for lung cancer and other cancers in the chest region, and you have a team approach to that. Why is that important?
Well, we have a thoracic oncology group that's been meeting essentially since I arrived here. Actually, it was organized before I was even here. I sort of, to some degree, took it on and organized it somewhat at this point. But it involves all the specialties that you would need for the care of a patient with a tumor in the chest. So you have the medical oncologist, the radiation oncologist, the radiologist, the pulmonologist, the cardiothoracic surgeons. I'm probably missing a few folks, but there's probably about 13 or 14 people sitting around the table every 2 weeks discussing cases that we see, that any of us have, quite frankly. Any one of those providers can bring a case to this conference. And it really does an excellent job of integrating the care. I think it expedites the care as well, so there's good communication among the different specialties that might be involved. If you want to get the opinion of a radiologist, they're right there in the room and you're looking at the films, and the medical oncologists are providing their input as to what they might offer the patient. Of course, the surgical input is provided from myself and my partner, Dr. Russo. So within an hour setting, you've done what might have taken 3 or 4 office visits for the patient to do, never mind the emails or chart or letters or whatnot that went out. So it's, I think, a very efficient way of delivering care.
You're involved in a big research project which has the initials ILCAP, which is kind of a national study. Talk about that a little bit.
Well, it's actually an international study. It's International Early Lung Cancer Action Program. It's a study that started back in the 90s at Cornell University. For a while, folks have been trying to figure out how we can improve the survival for lung cancer, which is one of the most deadly cancers that we have today. And the thought was, well, if we can pick it up earlier, just like you have your colonoscopy or your mammogram, we should have better outcomes. Unfortunately, the early studies with screening chest X-rays really didn't prove that. So as the technology has improved, the folks down at Cornell started looking at CT scans to try to detect lung cancers early. And they started this Early Lung Cancer Action Program. Eventually, more and more hospitals and programs joined, and it became international, and I think there's over 50 institutions now involved. We're the only institution north of, I believe, Hartford, Connecticut that's involved. But it's a very exciting study. There's well over 50,000 participants in the study. And what the study, the results have shown is that they are picking up lung cancers earlier, and we do believe we're improving survival. More recently, the National Institute of Health came out with a study, I believe about a couple months ago, at least the preliminary results of their study, which was a randomized study to lung cancer screening, and they found a benefit as well to lung cancer screening. Now, there's a lot of unanswered questions through ILCAP and/or this NIH study, but that's where ILCAP's an ongoing study that we're participating in, and I think ILCAP will hopefully be able to provide some of the answers to those questions. In the meantime, we've been participating for the last year. We've enrolled well over 100 patients so far, and I believe we have over 300 patients that are sort of teed up to be screened for lung cancer. We found one patient was found with lung cancer in that first 110 that were screened. That patient has subsequently undergone surgical resection and is doing well right now. So.
You're also involved in vein surgery. You want to talk a little bit about that?
Sure. Approximately 4 years ago, we were joined by the vascular surgeons, Dr. Reichel and Dr. Ingram, and have a certified vascular lab downstairs. So we started looking at expanding our services, and one of those services was venous disease. Now, as a cardiac surgeon, we deal with veins every day. That's what we use as our tubing. We're basically plumbers, essentially, and we need tubing and we use veins. So it's sort of a natural extension for us to expand into dealing with venous disease.
That's fascinating. Thank you very much. It's interesting and it's wonderful this is going on in our community. We'll be back with the next segment of this program in just a minute.